herniated disc, many immediately think of surgery. But the reality is quite different from that, because it's about the pain you want to get rid of, and how and why that works, I'll explain in this video. Because you can greatly reduce the likelihood of suffering a herniated disc. And the pain, in our experience, in most cases, had nothing to do with the herniated disc. That's already really good news that we can confidently assume most herniated discs aren't connected to your pain. That's actually the most common misconception for us, that the herniated disc has something to do with the pain. This is already evident from the fact that there are often incidental findings where people have herniated discs but are completely pain-free. And the next misconception, that the older you are, the more likely you are to automatically get a herniated disc, or that the risk increases when lifting heavy things, we see that very differently. So you really don't need to worry or fear that just because of your age, you're at a greater risk for herniated discs. The reality actually shows the exact opposite. Herniated discs increase steadily from the age of 20 to 30 to 40, peak at around 40, and then remain at a consistent level of approximately 65 to 75% of the population from 40, 50, 60 years old. So an incredibly high number. It's also a widespread condition, and then the numbers go down again. Why they decrease again, but back pain increases in older age, we'll clarify all of that later on in this video. We consider it a major misconception to assume it's a herniated disc. You only realize it because of sudden, intense pain, which forces you to rest and limits your ability to do things. You can still try to do something about the pain through movement. Why this works, all of that will come up in this video. First, let's take a look at what a herniated disc really is. Here you see the spine from the side, and you can see the vertebral bodies. And here you can see these in-between rings, so to speak. These are the intervertebral discs, and the discs cushion everything perfectly. They function like small shock absorbers, similar to those sometimes used in trucks, to reduce the impact between the two vertebral bodies, so that they can move smoothly, and the more elastic and flexible a disc is, the better it proves to be for the whole body and overall health and well-being. That's how it's designed. The disc has a gel-like core inside, and here on the outside, you can see this ring of fibrous tissue. And this fibrous ring, it essentially holds everything together. And a disc bulge now means that this fibrous ring is pushed outward, causing it to protrude beyond its usual boundary and shape. So it doesn't maintain its shape anymore, but bulges outward, going beyond its normal boundary. And then, when the force becomes too strong, it can tear apart completely, and then this gel-like substance starts to push outward. And the conventional theory is that this escaping mass then causes the nerves to be compressed, which ultimately leads to pain and so on. We cannot agree with this theory at all. In line with our own explanatory model, the actual root cause of the pain is something entirely different. Now let's take a closer look at how we believe a herniated disc first begins to develop over time. They often say it's a degenerative process. Over time, the ligaments gradually become brittle and weak. It doesn't hold well anymore, and over time, a fiber ring tears. We see it in a different way. And we need to take a closer look at how the biomechanics, the forces acting on the body, really operate and function. It's no secret anymore that we all sit way too much and most people don't compensate for it. And when we're sitting, we have this position with both legs, and there's this one muscle that plays a key role in our posture and movement control. That's the hip flexor, which runs from here, from the inner upper thigh area, across the groin area, with one part attaching directly to the lumbar spine, and the other part extending deep into the pelvis, to the ilium. And when it contracts, we lift the leg up into the air. And at the moment when the leg is in this specific position, the muscle becomes shorter. It's shorter than in the extended position. If we keep sitting all the time and don't actively balance it out, the body adapts and gradually changes its structure. The moment we adopt this angle, the muscles and the fascia get used to it. They even get matted, as we know from fascia research. So that when we then go back into this position, it pulls more and more forward, because this muscle naturally tends to stay in the position it has gradually become accustomed to over time. And then, when it is lowered, it immediately starts to pull from the exact spot where it is anchored on the opposite side. So it tilts the pelvis forward and pulls the spine forward. But since we want to stand upright and not in that position, our aim is to maintain a straight and balanced posture instead. So now we need to engage the back extensors and the gluteal muscles, meaning this entire area has to actively counteract the movement. Now just try to imagine this scenario. That if a force pulls forward and another pulls backward, where exactly is it pulling in that specific direction? Grab your shirt in the front and pull it down, then reach behind and pull back here to straighten yourself up again. Where does the pull go? It naturally pulls directly on the discs. Yeah, because they're the ones that transfer the force from the front to the back and also the other way around. That's how the tension works between them. If this process of shortening happens over years, over decades, it increasingly leads to the force pulling us forward becoming greater, and also the opposing forces that counteract it becoming more pronounced. The ones pulling from behind have to get stronger as well so that we can stand upright. To give you a small example, you surely know some elderly people who, at some point, find themselves depending on a walker because they can no longer manage to walk normally without any kind of assistance or support. They are then bent forward, holding on tightly and taking small shuffling steps with caution. And these people are essentially the pitiful ones who, because they don't realize the harm they're doing to their bodies, spend their entire lives sitting without ever balancing out the negative effects of that constant, prolonged sitting. And this eventually leads to effects that are closely tied to experiencing ongoing physical pain. It starts with you maybe having a job where you're standing all day and you notice that when you begin working in the shop at 9 in the morning, by 11 o'clock, you're already dealing with back pain. Then everything starts to tighten up here in the back. And if it's already quite advanced, you can't stand for very long without feeling the pain. You have to sit down, have to lie down, and when you lie down, then after about half a minute or maybe even a full minute, the pain gradually starts to ease off and you can stand up again. What's happening there? Picture this. You're holding a bottle in your hand. In Bavaria, they typically grab a beer mug and run the test to see exactly what's going on in this situation. And you want to hold that bottle and keep doing it for quite a long time. After some time, you'll notice that your muscles start to tense up here because they need to transfer the force being applied continuously. And depending on your fitness level, there will eventually be that moment where it starts to hurt and really begins to burn intensely, and at some point, the arm has to come down. That means muscles that are overworked eventually start to burn intensely, almost as if there were nerves on fire. Yes, that's really nasty. You'll know it from other situations. Imagine a force constantly pulling your torso forward, your pelvis forward, and the muscles here in the back have to work extra hard to counterbalance that continuous pulling force. At some point they'll get tired because that forward pull, it's the shortened fascia, it pulls like a rubber band, pulls forward, and the muscles in the back have to constantly work against it. Eventually they'll start to burn. That can be more in the lower back area if it's more about the torso that is also bent forward in itself, or it can be more in the buttocks area. In the area of the back, it is then said that there is facet joint arthritis. The facet joints are inflamed, and that's why they hurt. And in the area of the buttocks, it's more about the sciatica or buttock pain. But at the moment when the facet joint explanation should apply, why did the pain from inflamed facet joints completely disappear within just half a minute to a minute when the affected person lay flat on their back without any additional movement? Our understanding is that it's because the moment the person lies down, the resistance pushing against the back completely vanishes. Because the force pulls forward so much that it's no longer needed. Because when lying down, everything is nicely balanced and no force is applied. This means that the pain which arises in this initial stage of back pain is directly connected to, according to our explanation, the forces being so overwhelming that the back muscles eventually become excessively fatigued, that at some point they start to burn. As we said, we call this the first stage of back pain. These are really just muscle overuse pains, you could say, but the process doesn't just stop there, it continues. That means more and more force pulls forward, more and more has to counterbalance in the back, and there's increasing pressure on the intervertebral discs. And now the alarm pain comes into play. What exactly is the alarm pain? Well, take the situation that you might even recognize from your own personal experience. You had a long car journey, for example, driving on vacation for up to 5 hours without stopping. You've already been dealing with occasional back pain. You arrive at the destination after 5 hours. You get out, you try to stand up, and suddenly you realize, oh, I can't straighten up, my back is really hurting. And then you do it really slowly, look around, the people around are already staring, wondering what's wrong with you. You want to stand up, you want to get back on your feet, but at the same time, it hurts. Over time, you manage to get back up. It might take around half a minute, perhaps even a full minute, but eventually you're upright again and then you've succeeded. What's happening there? You have to imagine when that forward force keeps getting stronger and the backward pull also keeps increasing, then the discs in your spine get more and more compressed and squeezed tightly under the growing pressure because they're right in the middle of that force transmission field. And if they keep getting compressed more and more, we assume that a huge number of receptors send a massive amount of information into the brain, and that's where the big processing factory is, constantly analyzing and interpreting all that data. And that's where it gets calculated at which point the intervertebral discs are at risk. Because remember, there's a gel core surrounded by a fibrous outer ring around it. And this fibrous ring has to resist more and more as the discs get increasingly compressed over time. And now we assume that when this compressing force surpasses a specific threshold, the disc becomes increasingly vulnerable. And the fibrous ring may tear due to the pressure reaching an unsustainable and critical level. That the body wants to prevent that. And how does it prevent that? In the example of getting out of the car, you are sitting in your protective posture again, with a tight and shortened hip flexor muscle, limiting your range of motion. Now you want to get up. And when you try to stand, the tight muscles in the front keep resisting the motion, while the back muscles have to work even harder to counteract and balance out the tension. That means only when the tension in the front is fully released does the pressure on the discs decrease again and return to a more normal state. That means if everything is very tense at this moment and you suddenly try to get up, it's just not possible because the pain starts right away, making it completely unbearable to move. So you might come up a little, then the front area has to give in again, the strength decreases, the load on the disc, you go up a bit more and so on, step by step, gradually increasing the movement, until you are completely upright. And that's what we refer to as alarm pain. The purpose of the alarm pain is to protect the disc from any potential harm or injury. And where does the alarm pain actually manifest itself? Well, quite logically, it tends to show up in the back extensors because that's precisely where the force is generated, which then directly results in the discs being subjected to pressure and strain over extended periods of time. Because in the front, it just pulls and you're not generating any force forward. There's only this resistance from the inflexible muscles and the inflexible fascia. But in the back, the brain can actively take control, since there's active muscle involvement present in that area. And if pain is redirected to the back, we instinctively react to it, only moving as far as it's still bearable, not pushing further, but deep down, we genuinely want to keep going and progress beyond that specific point. And then it gives way forward, and eventually we gradually work our way up until we're back to standing again. And this whole situation culminates then in what's called lumbago, lower back pain, or lumbosacral radiculopathy. Just an overwhelming, unbearable pain that you can't endure, no matter how hard you push. So how does lumbago actually come about? There's this theory suggesting it happens because a disc is genuinely injured, that the annulus fibrosus tears. And that would then be the pain of the lumbago. We see that completely differently as well. At the moment when the force here in the front becomes increasingly stronger over the years and decades, and now we are bent forward while gardening. We are leaning over, working in this position, doing some tasks or pulling out weeds from the ground, staying in this posture for a while as we continue working. We are in the sitting position again. Even a bit exaggerated. And suddenly someone calls out, "We are starving." And suddenly someone shouts, "Food is ready." And we are hungry, get up. And some invisible force pulls us right back down and we think to ourselves, I really do want to go and eat now. So we try to get up again and then the witch hits from behind. Suddenly you have this excruciating back pain. What has happened? Let's see, period. All the muscles here in the front that have shortened over time have been getting more stressed over the years. And there's also a huge amount of stress back here. You can already tell from when you get a massage in the lower back area that the masseurs or masseuses always say, you've got a really tight back, real hard tension in the area. Right, because back here there's absolutely no weakness at all, which is something that's often assumed by people. Back here, there's way too much tension because the front pulls down so heavily that it completely overwhelms everything in the back. So stress in all areas. If the muscle already under tension in the front, the rectus abdominis and the hip flexor suddenly gets lifted and forcefully pulled apart in a quick, uncontrolled motion like that, it's bound to lead to even more problems. Then there are reactive receptors in the muscle. Those are the muscle spindles. And the muscle spindles, if the muscle is pulled apart at a certain speed, they counteract by contracting the muscle to protect it from overstretching. That's right. That's a protective reflex which the body probably set up for that reason, so that a joint doesn't hit its end range, but rather gets somewhat slowed down. Anything too fast, the body dislikes, especially when stressed. And at that moment, as I mentioned earlier, when I rise up quickly, I manage to go up on the first try. But then those muscle spindles instantly react and pull me straight back down again without any delay or warning at all. That's the effect of the pull forward. If you've ever experienced it, the lumbago, then you might even know it if you were consciously aware during that movement. So, and now the front is completely rigid and unyielding simply because it's under so much tension and stress. The stressed muscle, the musculature was torn apart, contracted in reaction, and absolutely doesn't want to give in at all for the time being now. That means every uprighting motion, imagine this up front, if I pull firmly on the shirt like this, and there's a counter pull in the back and I don't give in at all, then the entire force of the uprighting movement transfers directly onto the spinal discs without any relief. And because of that, the body has no other choice. It has to trigger a very, very intense pain, and that's the lumbago. And you might know it. Sometimes it takes days or even weeks until it returns to something somewhat normal. I'll show you later how you can achieve that much faster. Now, let's move on to the discs. What's going on with the discs throughout this entire situation? One thing is absolutely certain. The pressure on the discs continues to increase significantly. You can understand that already. Just like the cartilage in the joints, the intervertebral discs aren't supplied with blood directly either. Instead, they receive their nutrition through diffusion, through what's called, well, the surrounding fluid. They release waste products into it and then absorb nutrients from it again to replenish themselves. So ultimately, the intervertebral disc functions in a way very similar to how the joint does. It is structured differently, but in principle, it's the same. To make it very clear, what does the intervertebral disc need? So, what exactly provides the necessary pressure and relief for an intervertebral disc to function properly? Yes, for example, when I lean backward, it relieves the front region and increases the pressure on the back part. When I lean over to the left side, I experience pressure on the left and a noticeable relief on the right side. And the other way around, when I rotate my body to the left and to the right, the disc gets evenly compressed across its entire surface area completely. And when I go back to the neutral position, it gets released once more. That means I have a constant supply of nutrition for the discs. But if the load keeps increasing and without movement, the relief doesn't happen anymore, the discs start to suffer and deteriorate over time. Then, the disc falls into a nutritional deficit and gradually deteriorates. That's what we refer to as the slow death of the disc. No nutrients are able to get in, very little is happening, and what's not being nourished naturally breaks down, so the disc becomes thinner and thinner over time. So the pressure causes it to be compressed, and at the same time it's not being nourished. That makes sense, which is why, as we get older, the discs naturally tend to gradually lose their thickness over time. But as I mentioned, age isn't really a factor for us in this case. It's all about this negative training, where the pressure steadily keeps increasing. That, by the way, is also the main reason why, based on my interpretation and understanding of biomechanics, the frequency of herniated discs tends to noticeably decrease again as individuals grow older. Because the height continues to decrease, and the lower it becomes, the less likely it is for something to burst or tear apart completely, or bulge. And now to the rapid degeneration of the disc herniation. The most widely known scenario involves the water crate being lifted out of the trunk of the car. It can definitely happen. Some also say they heard a distinct popping noise and immediately realized when that fiber tear actually took place. But let's take a closer look. I claim that when someone lifts a case of water out of the trunk, regardless of their current state of tension or physical condition, and does it slowly, carefully, and with very deliberate control, then it would hurt beforehand in such a way that it couldn't possibly lead to a herniated disc. Injuries such as herniated discs, fractures, or other damage where tendons tear, in my opinion, always occur at high speed and never through gradual or slow movements. Why? Because the body can't react quickly enough in time. And now imagine. You have this intense pressure on the disc, which is already heavily strained. And now you walk over to your car and lift with a quick, sudden jerk, because it feels much easier to grab the box that way. Then there's a peak load, a noticeable and significant increase in pressure once again. That's multiplied several times over, and you can quite easily end up with a herniated disc. But was it the lifting of something too heavy, or what was it? I say it wasn't the lifting of something too heavy, but rather the constant strain and pressure that had been gradually building up on the disc over a long period. Then, on top of all that, the increase in lifting, the sudden lifting, the disc simply couldn't handle that level of force or the pressure being placed upon it, if the person had taken the time to properly normalize that tension beforehand. They likely could have managed to lift the crate even with the sudden jolt, doing so entirely without causing any injury to themselves. Perhaps just briefly on water loss. Yes, one aspect of this degeneration of the intervertebral discs is indeed the loss of water, which is again associated with aging. And the water loss means that the annulus fibrosus also becomes drier, more brittle, and more prone to tearing. But the water loss is also something we've caused ourselves. It happens because the pressure and relief are absent, which leads to the metabolism slowing down dramatically. That's why there's no water. And the more this development progresses in your body, the more symptoms you naturally start to experience. You can experience back pain in this specific area, and it might even extend over the entire buttocks region completely. The sciatica can come into play. It can radiate down into the legs. You might also, aside from the symptoms you could feel, develop a slipped disc. There can be shifts in the spine, different leg lengths resulting from that condition. That the hip joints, which are involved in this whole pulling force that's built up, are positioned differently, and that can lead to noticeable misalignments of the hip over time. All of that is related. That was what we call the negative spiral, which ultimately, as I mentioned earlier in detail, ends with the unfortunate situation for many people who eventually depend on a walker and completely losing all mobility in their legs over time, because everything has become too rigid and tightly fused. Movement is simply no longer possible. Now let's move on to the positive spiral. How can we manage to get out of this entire dead end, which ends with you leaning over the walker, no longer able to stand up straight, maintain proper posture, or move around freely and comfortably? Only able to take tiny little steps because everything is too short and too tight. How do we get out of that? The most effective approach, the best way forward, is to gradually reintroduce movement into the system. That means we should go to the root cause, so to speak, which is the tightening right here in the front. And at the moment when I can release this shortening, something that happens, for example, when these muscles are relaxed through our osteopressure technique used by our therapists. It's truly fascinating to observe a lumbago patient, often a severe case, because they suffer from intense and debilitating pain when they experience relief. For 15 to 20 minutes, manage to completely relax all the muscles in the front area and then also those in the back area, where the reactive forces are typically absorbed and balanced. If everything is fully relaxed, the root cause of this lumbago, this sharp pain, is completely eliminated, and then the lumbago doesn't hurt anymore either. There's a truly effective and gentle method where you can, even with a severe case of lumbago, help yourself and find some relief. I'll explain it to you. Just lie on your back, but with your knees bent, because you'll notice when you have lumbago, it's almost impossible to lie completely flat on your back with your legs fully stretched out. Because the hip flexor, which pulls the legs up, is so short, tight, and stressed that it actively resists any attempt to lengthen it further. That means you lie on your back, keep your legs bent. This has a bit of similarity to that elevated leg position as well, just so you're aware. Often you can find relief from hip or back pain by lying flat on your back and resting your lower legs, specifically your calves, on the chair. And in that moment, the back pain and hip pain usually improve significantly. I don't recommend that as a permanent solution because then you're doing nothing but protecting yourself again and not addressing the root cause. Then you won't find a way out of this whole dead end. But now, as a step to help yourself, lie down flat on your back, bend your knees comfortably, and let your back fully relax and settle into the surface beneath you for better support and relief. Take your time with it and really focus on gently easing your lower back down closer to the floor as comfortably as you possibly can. In the ideal scenario, your lower back should fully come into contact with the floor. It might feel challenging because everything is already pulled inward due to the tightness in your hip flexors. But at least as much as you can. And when you are lying down, you let your knees drop further by gradually straightening your legs so your feet move further away from you, so that your legs gradually become straighter. And then at some point, you will start to feel it pulling more into your lower back area. And then you stop that movement, stay in that position, which should be adjusted according to the intensity of the stretching pain that's being triggered specifically in your lower back area now. It must still be a comfortable pain, but a noticeable comfortable pain. And then you wait 10 to 20 seconds and continue moving further down. And what does that mean from a biomechanical perspective? That the hip flexor gets stretched more and more. And if you have acute lower back pain and take half an hour, 3/4 of an hour, it could very well be, we've seen cases like that you can relax the muscle sufficiently enough to avoid experiencing any major issues or ongoing discomfort afterward. And can at least walk again. You might still notice it, especially when overstretching because it gets pulled even more, but you'll be fully functional again and ready to handle your daily routine. So you can already understand what's crucial with back pain, that what has grown too tight in the front over the years and decades needs to be stretched out and lengthened again. And the next exercise, especially for those of you as sciatica patients, when you can lie down with your legs, would be standing preferably in front of a wall so you can hold on a bit. And you push your groin forward while slowly bringing your torso back into position. And then, depending on your condition, which is also a good test for you, depending on your condition, you will notice very quickly or only later that it starts to pull into your back, into your groin, into your abdomen, but primarily into your back. And how you manage to overcome this issue with an exercise specifically designed to directly address and effectively relieve lower back pain is exactly that. You keep stretching further back for a full 2 minutes straight and maybe repeat that once or twice each day to really make a difference. If you're really affected by back pain, I would even suggest, if you're a desk worker, meaning you spend your entire day sitting at the computer, to stand up once every hour, stretch intensely backward for a full 2 minutes, and then slowly return to your original starting position. That's one thing that can definitely help you keep back pain in check at first, so it doesn't build up further, and you'll feel noticeable relief each and every time you take just a moment to do it. Now you might say, if it were that simple with back pain, why do millions of people suffer from it, struggle daily, and still have no clear idea of how to fix the problem effectively? And yes, the last thing I mentioned, they simply don't know what to do. That's really the core issue. And also because it's so easy. Just imagine, it's the #1 common ailment when it comes to pain, lower back pain. Can you believe that such a simple exercise can help? Yes, it does, but it's really hard to believe at first. It's really hard to believe. You have to try it. Even my wife, who is a doctor, back then 38 years ago when we first started developing this, she observed it with a lot of skepticism. What I had discovered, and we really talked about it extensively, but she didn't fully believe it. She didn't believe it for a long time. It definitely took a few years until she experienced her own sudden backache and finally decided to let me step in and help her out. And I helped her out with this method. That sudden backache was completely gone after the treatment, and by the next day, even the evening before, she didn't feel a thing anymore. She was actually dot. In the process of planning to give a talk at our children's school about nutrition, and she absolutely wanted to give it, and that was the reason why she said, okay, let's do it. Now show me what you can do, something along those lines, and it worked out, and it's just one of my many, many cases. There are thousands, even millions of cases by now that have moved forward exactly like that. If you're still having doubts and thinking, I'd rather not try this, who knows what could happen, then just have some fun, head over to YouTube, search for back-related videos, and spend some time scrolling through the comment section. And then you'll gain more and more confidence that it's really worth giving it a try yourself. And now I want to make you even more confident to at least give this path a proper try for yourself and then gather your own experiences along the way. It's really crucial to understand that 80 to 90%, and there's an Australian study that even mentions 99%, of lower back pain cases are categorized as non-specific pain. What is non-specific pain? It's the type of pain where there's no clear diagnosis, where there are no specific findings, and where it's not visible that a disc is bulging, where no herniated disc is detectable, where no slipped vertebra is observed, where no facet joint inflammation is in any way. Traceable, meaning there's usually no identifiable reason for the back pain to occur. And that's precisely where we say our explanation comes into play, focusing on what remains invisible to the eye, which is the tension of the muscles and fascia. You don't see that on any X-ray, MRI, or CT scan. And that's why it's frequently overlooked by many. But it's definitely there. You can even feel it clearly. On the other hand, as we already talked about earlier, there are a ton of incidental findings. I believe there are also corresponding studies that have examined this, showing that a significant number of people have herniated discs, even multiple ones, and remain completely unaware of it, because they never experience significant pain. This clearly demonstrates that the supposed causal link between a herniated disc and pain cannot be truly causal. We consider it, to explain it once more, as a simultaneous occurrence of these events. The increasing tensions forward and backward, the compression of the intervertebral discs, they naturally cause wear and tear on the facet joints. They cause the intervertebral disc, as we talked about the slow dying, to become flatter and flatter. And they also contribute to causing a herniated disc. However, they are just one result of the excessive tension that accumulates and persists within the body. And the other result, which sometimes occurs simultaneously and sometimes not, as I just explained, is the pain that arises. And I will never forget it. I did hold a lot of training sessions. Since 2007, we have trained over 15,000 doctors, naturopaths, physiotherapists, and health-related professions in this therapy. And I also had a lot of orthopedists in these courses. And once I had an orthopedist who told me, "Roland, this absolutely aligns with my observations because I've always thought about it. How can this soft, jelly-like mass that leaks out when the annulus is torn, how can it actually have such a significant impact on the nerve, which is as thick as a finger in that particular region of the spine? How can it affect such nerves, press on them so strongly that it leads to these intense pains developing there?" And when he then followed through on what I explained about our model, that it's a simultaneous occurrence and that the pain doesn't actually come from the annulus fibrosus being ruptured, but that it was merely the structural damage occurring simultaneously, then he clearly saw that it fully matched his observations. And for him, it made perfect and undeniable logical sense. Now that you've fully understood our perspective on how a herniated disc develops, it's clear to see the steps you can take to effectively prevent it from occurring in the future. Simply by stretching the front, also stretching the opposing reaction in the back, the tension on the discs, this fundamental tension that is incredibly high in many people, can be reduced. That you reduce through this exercise. And if you want to try it yourself to help manage your back pain and prevent potential disc herniations in the future, give it a go and see the benefits for yourself. Then click here. I've got a 10-minute exercise video for you. Enjoy and have fun with it.